Hello, this is Dr. David Green, CEO of the California Pain Network. Today's topic is the indications for spinal discectomy surgery for sciatica. Sciatica occurs in 1 to 2% of the population at any given point in time. Most have no clue what they did as an inciting event. It just comes on out of the blue. It's typically due to slow disc degeneration that eventually results in a tear of the outer portion of the disc with the inner part squeezing out. So this part bulges, and you get a tear, and the inner jelly squeezes out and hits a nerve root. Symptoms of sciatica are going to vary between patients. This may include leg pain, can include a burning or pins and needles, maybe some numbness, possibly weakness. You can see here if certain nerves like the L5 is pinched, you can end up getting a foot drop where you have trouble lifting up your foot. Rarely you can get incontinence. That's called cauda equina syndrome. That's a surgical emergency. Initial treatments for sciatica should include a short period of bed rest. No longer is it recommended to stay in bed for a week. Over-the-counter medications, anti-inflammatories, Tylenol, physical therapy, chiropractic, spinal decompression therapy has been shown to be over 80% effective. The prescription medications that can be administered may include a Medrol dose pack, which is a 5-day burst of prednisone, which can provide immense relief, but should not be used more than once every few years. Narcotics can be helpful for short-term as well as muscle relaxers, and then neuropathic medications, such as Neurontin, Lyrica. We don't know how they work, but they do work very well. Interventional treatments may include what you see here, which is an epidural steroid injection. Here you have a disc herniation, pinching on a nerve root as it tries to get out from the spinal cord. And here are needles going in that area with steroid medication going around the nerve root to provide a huge anti-inflammatory medication. Trigger point injections can be very helpful for muscle spasms and aching. There are 3 types of indications for surgery for sciatica. One is absolute, gotta have it, otherwise something really bad is going to happen. The other one is relative, and I'll explain what that means here in a moment. And the third is simply quality of life. You don't have to have surgery, it's not absolutely necessary, but the quality of life is such that it makes sense. So absolute is when you start to have bowel and bladder incontinence, and you have a huge compression in the midline here, not just of a nerve root, left or right, but a big midline compression. And that can cause irreversible incontinence and difficulty walking if it's not treated right away. Meaning right away means studies show within 24 hours that should be taken care of. Otherwise, the bowel and bladder incontinence may never get better. So relative, what I mean by that is if you're having a progressive neurologic deficit or motor weakness that not necessarily is progressing, okay? So it may be that it's pushing on the L5 nerve root, the person develops a foot drop, and it might be a partial foot drop, and then it might be a full foot drop. If it's progressive like that, the relative indication is to go ahead and have surgery. You can watch that for a while, but the problem is if you watch it for too long, like over 3 months, the question is at what point is it never going to get better, even if you then go on to have a technically perfect surgery. It's unknown, patients are different, there's no black and white rule on that. Now, elective quality of life decision is if you've had over 6 weeks of conservative treatment that may include any of the things of what you see here, and it's basically numbness and pain, but there's no muscle weakness, no bowel and bladder issues, then you may consider wanting to have surgery. There are some studies showing that at 1 year, there's no difference in the outcome, but it may be that you're unable to effectively work, concentrate, things like that. You can get out of pain faster. Less than 10% will need sciatica surgery. Over 90% good to excellent results with a discectomy procedure. However, the study in 2006 showed that if you don't have surgery or if you do, the outcomes are identical at 1 year. So surgery did help increase mobility and decrease pain faster, but if you can achieve non-operative pain relief over that period of time, the results are going to be no different and you've avoided any of the risks of surgery. The top non-operative pain management throughout California is with the California Pain Network. There are multiple pain clinics throughout the state, including San Diego, Orange County, LA, Inland Empire, all the way up to San Fran and Sacramento. There's over 90% overall success rates with the treatment. Over 25 treatment options are provided Most insurance is accepted, personal injury, workers' compensation as well. The pain doctors are board certified and award winning. So visit us on the web today at californiapainnetwork.com and then call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.